day 1133 of this Trump administration. That leaves 251 days until our 2020 presidential election. And tonight, the United States is preparing for the possibility, indeed the government says the inevitability, of an outbreak of the coronavirus. Just yesterday, in fact, an official with our Centers for Disease Control said, quote, "It's not so much a question of if this will happen anymore, but rather more of a question of exactly when." Not according to our president today. That quote was from yesterday when Trump was out of the country. Today, back from India, he gave a markedly different view of the effort to contain the coronavirus. Among other things, he said it's a flu, said there are just 15 cases in the U.S., and of those fictional 15, he said they are either better now or close to being better. He doesn't think the spread is inevitable. He says China's president is working so hard to contain it, and he believes him when he says he's reversing the trend. The president also announced Mike Pence has been put in charge of the effort to combat and contain the virus. Now some real numbers, and this first one has the president unsettled. The Dow has dropped over 2,000 points so far this week, largely because of uncertainty over coronavirus and the supply chains for global products that have already been disrupted. So far, more than 81,000 people have been sickened worldwide. Over 78,000 of those cases are in China, that we know of. The virus also spreading throughout Europe now, Italy reporting over 400 cases. And tonight, that same CDC is confirming a new and concerning case in California. Concerning because it's a victim with no known recent travel history, no known recent exposure to anyone carrying the virus. And with that, they say the number of Americans with coronavirus is 60, not the 15 the president kept referring to as he went out of his way to say he doesn't think it's inevitable that it will spread to the U.S.
I don't think it's inevitable. It probably will. It possibly will. It could be at a very small level or it could be at a larger level. Whatever happens, we have a total of 15 people, and they're in a process of recovering, with some already having fully recovered. We're at that very low level, and we want to keep it that way. So we're at the low level. As they get better, we take them off the list so that we're going to be pretty soon at only 5 people. And we could be at just 1 or 2 people over the next short period of time. And again, when you have 15 people, and the 15 within a couple of days is going to be down to close to 0, that's a pretty good job we've done.
Again, to be clear, the total number of confirmed cases presently in the U.S., including evacuees from other countries, is 60. The president also made this prediction about a vaccine.
It's a little like the regular flu that we have flu shots for, and we'll essentially have a flu shot for this in a fairly quick manner.
But moments earlier, a CDC official from that very same lectern said a final vaccine is at least a year to 18 months away. Washington Post is reporting Trump is again very worried about the economic impact of all this. Quote, Trump is highly concerned about the market and has encouraged aides not to give predictions that might cause further tremors. Privately, Trump has become furious about the stock market slide. And earlier today, the president accused the media of, quote, doing everything possible to make the misspelled coronavirus look as bad as possible, including panicking markets if possible. Just yesterday, the president's acting Homeland Security Secretary, Chad Wolf, was grilled on Capitol Hill. Republican Senator John No Relation Kennedy of Louisiana was not impressed with what he heard.
How many are you anticipating?
Again, we're working with HHS to determine that.
How many are you anticipating?
We do anticipate the number will grow. I don't have an exact figure for you, though.
Do you have an estimate? Is someone modeling that? Do you have any way of guessing?
Again, HHS, through their medical professionals.
Well, yes, sir, but you're head of Homeland Security,
yes, sir,
and your job is to keep us safe. You can't tell us how many your models are anticipating.
No, Senator. Again, I would defer you to the Health and Human Services for that.
Okay. Don't you think you ought to check on that?
We will.
As the head of Homeland Security, how is it transmitted?
A variety of different ways, Senator.
Tell me what they are, please.
Again, human to human is what we've primarily seen.
Human to human, how?
You're asking me a number of medical questions that
I'm asking
CDC
you questions
and HHS
because you're Secretary of the Department of Homeland Security. and you're supposed to keep us safe.
Yes, sir.
And you need to know the answers to these questions.
It went on like that, and today, veteran journalist John Harwood pointed this out, quote, President Trump responds to coronavirus with an acting White House chief of staff, acting intel director, acting Homeland Security secretary. He has launched a loyalty purge. He wants to cut CDC and NIH budgets. He eliminated NSC post to safeguard against global pandemics.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.